Let's start with the questions.
Okay. So actually, Udain is there, doctor. So he want to have a conversation with you. So I'm inviting him to the live. Okay.
Hi, Uday.
Good evening, doctor.
Hi. Good evening. How are you?
So my question is, my father recently had a heart attack and underwent a stent procedure. So he is feeling much better now, but he's still a bit anxious about his heart health. He's very keen to learn about the latest advancement in cardiac care, and particularly curious to hear from the expert cardiologist in US. So can you give me a suggestion what we can do?
Okay. Sorry to hear about your father's heart problem. So unfortunately, heart attack is a very common condition among Indians. In South Asia especially, people tend to get heart attacks at a much younger age compared to the other populations, like what you may be used to in America, the white population or the other ethnicities. We in Indian origin, Indian heritage itself has a higher risk of, it could be part of genetics, part our diet, upbringing, all those things can contribute, exercise, physical activity, all those things. So now that your father has a heart attack, that means, he had an event. So the prevention stage that we referred to earlier about exercise and all those things are more in the prevention area. Now that he has had a heart attack, he should be much more aggressive in managing his risk factors and taking the medications. So, for example, when you had a heart attack, most likely the doctors may have put in a stent. So it depends on how many stents he had. If it's only one stent, one area of blockage, or multiple areas of blockage, so all those things can play a part in what's his risk in future heart attacks. If he has other blockages that needs to be aggressively managed. So the main treatment lines are being on cholesterol medications, being on antiplatelet or blood thinners, and being on healthy diet, exercise. And after heart attack, we always recommend something called cardiac rehabilitation. What that, in the US at least, what we do is we let patients go through a structured exercise program where they will be monitored by an expert who will watch their blood pressure, heart rate, ECG, everything while they're exercising. And so that the person will know how much they can safely do exercise. And the goal is after they finish their session, they'll continue doing that throughout for the long term, throughout the life or long term as well as they can. They'll also guide you in healthy diet. So basically, to your question, without knowing the specifics about your father's heart attack and how much blockage, and then there is something else called heart function or ejection fraction, how much the heart is pumping blood, how efficient is that in doing its function. All those things can certainly play a part in making a decision or recommendation in managing its long-term risk. In summary, I would say aggressive reduction of cholesterol, being on the right medications for the antiplatelet or blood thinning medications, and like we discussed, everything else, the socioeconomic, supporting the patient with exercise and diet recommendation, all those things to be helpful. Does that answer your question?
Thank you, doctor.
You're welcome.
So I will proceed.
Yeah, sure.